Hi, this is Dr. Prasad. Let's talk a little bit about some antiviral drugs, just to, and there are many, but we're going to talk about acyclovir and zidovudine. The content here does correspond with chapter 40 in your Lilly et al. Textbook. There are a couple of videos I posted, video links to videos with this lecture that I'd like you to take a look at before we proceed, because they'll help you understand a little bit about how viral replication occurs. And I want you to remember there's a difference between viruses and bacteria. Viruses cannot replicate on their own. They do not have that ability. They need a host cell in order to do that. So they come into the body and find a host cell in which to plant themselves, and then they hijack that cell and take over the DNA process, and they replicate their own DNA, or it's actually an RNA, but they make it look like a DNA, to then make more of the virus. And that's the only way they can work. So they have to have the host cell, and they use that cell's energy even to synthesize proteins, DNA, and RNA. This is part of why they are so difficult to kill. And I want you to understand that any drug that kills a virus is going to kill the host cell as well. How do viruses even enter our body? I think this is general knowledge that you probably already know. But remember, we can inhale viruses, we can ingest them, they can go across the placenta, and then inoculation, where we actually inoculate somebody with a virus. But so on our hands, we can carry these viruses on our hands, and that's how they get inhaled as well. They get put up to the face, the hands touch the face, or the eyes, or the mouth, or ingest. We touch food and eat it, and with unclean hands that have viruses on them. And so one of the videos that I had posted that I wanted you to watch was this one about fighting the coronavirus with soap. And it's not very long. It's fairly brief, but it's very, very good at showing exactly how soap works to help get viruses and then also bacteria and everything off the hands. And it underlies the importance of good hand washing as part of the fight against any types of infection, viral or bacterial. So make sure you please watch that. Here's a list of viral illnesses, and it's extensive. You can see there's a lot of different types of viral illnesses, and we don't have cures or treatments for all of them. But we do have prevention for some, like smallpox. We can prevent flu. We can prevent herpes, certain strains of human papillomavirus. And then we treat other things. One thing to understand is that most viral illnesses are bothersome but survivable. And again, you know that we have vaccines that have prevented some illnesses related to viruses. And now on the next slide, I'll show you a small number of viral infections. Whoops. Oh, this one. Here we go, this slide, that are actually controlled with antiviral therapy. And probably the ones that are the most common that you would see in primary care practice, community practice, will be the herpes virus, like with shingles, reactivation of the herpes virus that way. Even hepatitis, now we have ways that we can treat that virus. The flu virus, influenza, and RSV. Let's see what was on this slide. Okay, this is a little bit about how antiviral drugs work. They kill or suppress the virus by destroying the virus in cells or inhibiting their ability to use that host cell to replicate. What are the key characteristics of our antiviral drugs? Well, they are able to enter the cell that is infected by a virus. They interfere with that viral nucleic acid synthesis, or with the regulation, or both. So now what the virus intended to do by coming into the host cell and using it to make energy and manufacture replications of itself, it interferes. The antivirals interfere with that process. Some of them actually interfere with the ability of the virus to even bind to the cells. And I hope you watched that first video about viral replication before entering this lecture, but it shows you how a virus binds to the cells, and it's that binding at that receptor site that allows the virus to be invited into the cell, the host cell. So right there at that action is where some of the drugs work. And some work by stimulating our body's immune system to fight off the virus. So you hear of antiviral drugs, and then there are antiretroviral drugs. So antiretroviral drugs are going to be used specifically in the treatment of the human immunodeficiency virus, and that's the virus that causes AIDS. And that's because that virus, the HIV, the human immunodeficiency virus, is a retrovirus. And I have another animation to help you understand exactly what a retrovirus is and how it also works using a host cell, but it's a little bit different and it's much more damaging than a regular virus. And the other thing about the HIV is that it specifically targets T cells for to be hosts. So that means we're going to affect the immune system, because once those T cells have been invaded by the HIV and taken over, they no longer function in the immune process. That is why we have immune issues with HIV. It's called the human immunodeficiency virus. So let's talk a little bit about the herpes simplex and varicella zoster virus infections. And these are caused by regular viruses, not retroviruses. And herpes viridae has all these different strains. And so you know that we have a vaccine against HPV, the human papillomavirus, which is a strain of herpes viridae. And that one would be HSV2. Now, HSV1 is the oral herpes virus that you see that people get around usually it's the outside of the mouth. Chickenpox and shingles, we have that's HHV3, or also varicella virus, VZV is how that's also identified sometimes. And then we've got all these others down here. The last one, the Kaposi sarcoma, is HHV8. It is a sarcoma, but it's caused by a virus, and that's as a result of immune deficiency and generally associated with the human immunodeficiency virus. We have more here. Here's our genital herpes. HSV2 is highly transmissible, and it's also called neonatal herpes because it can be transmitted from mother to child if the mother has active herpes virus infection at the time of vaginal delivery. So here's some pictures of herpes simplex and varicella zoster virus infections, also known as shingles. But I want you to notice they usually go along a nerve tract called a diode. And you can see here that it goes along that nerve tract here. These are very common areas. Other unfortunate common areas can be the face and around the eyes as well. What happens is this is extremely painful even before the lesions are known. It's a painful pins and needle sticking kind of sensation on the skin. And what can happen is after the virus has gone through all of its stages and you no longer see lesions, that painful nerve damage continues, and that's called post-herpetic neuralgia. So what we desire to do is administer acyclovir as soon as we know that there's a potential for a shingles outbreak. And that's generally the patient complaining of the sensations, the uncomfortable sensations on the skin before they even see the lesions. And we need to start the acyclovir as soon as possible to help prevent the nerve damage. So how do they work? What's the mechanism of action for acyclovir? And most of the antiviral drugs, they work by blocking the activity of a polymerase enzyme that normally stimulates the synthesis of new viral genomes. So what you need to take away from that to remember about antiviral drugs is that for the most part, they work inside the host cell. What are the indications for acyclovir and our antiviral drugs? Well, they're used to treat non-HIV infections. So the HIV infections are going to be treated with antiretrovirals, not antiviral drugs. So we can use, there are influenza viruses that we have drugs. You might have heard of Tamiflu, and the herpes simplex, the varicella zoster, CMV, the cytomegalovirus, and hepatitis. These are the indications for antiviral drugs. Remember, you don't need to know the drugs for all of those. We're focusing on acyclovir as our antiviral drug. Well, what kind of adverse effects can happen? Well, there's a whole list of antiviral drugs, and each drug has its own most significant adverse effects. But overall, the adverse effects are typically minimal, and it's usually very well tolerated. But remember that a healthy cell is also going to be killed. So depending on the type of virus that we're treating, so I'm going to go back over here, and the degree of significance of that virus is what's going to tell you more about the adverse effects. So when we treat a virus that's causing hepatitis, I want you to know that we're going to be treating with a much stronger antiviral drug, probably for a longer duration of treatment, and the adverse effects are going to be more significant versus treating something that's caused by a seasonal influenza. It's not going to have the adverse effects associated with it that are as much because it's not going to have the long course of treatment. I think headache and or just myalgia and not feeling well are typically your usual adverse effects with our normal antiviral drugs. So here's a Virax or acyclovir. It's a synthetic nucleoside analog. That's just so you know, that's the type of antiviral drug that it is. And it's used to suppress replication. So remember I told you it works inside the cells. It's not one that walks the receptors on the outside of the cell. It works inside. So the host cell is going to die as well as killing. That's how we kill the viruses. We kill the host cell. So it suppresses replication of these viruses listed here. It is the drug of choice for initial and recurrent episodes of these herpes simplex and varicella zoster viruses. It comes in an oral, topical, and IV form. So you can imagine topical would be very commonly used for the lesions and the outbreaks that may be around the mouth or the genital area. And for shingles, we're going to use the oral form typically because we need to get more of a systemic effect. Because if you have shingles along one dermatome in the nervous system, then there's a potential for other dermatomes to also be activated with the shingles virus. And so we want to take it orally or IV depending on the significance of the infection because we need to get a more systemic response. Whereas the genital herpes outbreak and the oral herpes outbreak are more local responses, and those can be used with the topical form of the medication. I post this for you as well. It's a nice, brief patient teaching video about what are your side effects and the overall patient counseling, the things you need to teach your patient about if they're taking acyclovir. So that's an important watch for you, because I won't reiterate what they talked about in the slides here. Let's move on over to the antiretroviral drugs. And remember I said HIV is a retrovirus. And to help you understand a retrovirus, I have a video animation that I've selected for you. And really that's the thing that I think will help you most to understand what a retrovirus is and how our antiretroviral drugs work. Now, the statistic I have here was through 2014, and this is much later now, but new cases have decreased, and they're showing the time period between 2005 and 2014, an almost 10-year period, but new cases of HIV decreased by 19%. This is a statistic that should continue to grow because we now have drugs that are considered PrEP or prophylactic antiretroviral drugs for people who may be at high risk to contract HIV And so we're hoping that with the prophylactic treatments in high-risk populations, we'll see even more occurrences of HIV and AIDS starting to drop. HIV is transmitted by sexual activity, IV drug use, perinatally from mother to child, or even needle stick transmission, which is bloodborne. And that is how healthcare workers can come into contact with this virus through cutaneous needle stick. And it's calculated for us to be at about a 0.3% transmission rate. There are 4 stages of HIV infection. And that's just an overview here so that you understand that it's stage 1 and 2 that are the most worrisome because it is active disease and it can be transmitted to a partner or to somebody else when the person does not even know they're infected yet with this HIV. And if you remember how viruses work, is they have to get into a host cell and use the host cell to replicate. So that is why it's called subclinical. That's why these stage 1 and 2 really, they don't feel any different because we're focusing on the T cells. The immune system is still functioning well because the virus, there's not enough viral load yet to affect the immune system completely. But as that virus uses those host cells and replicates and replicates and replicates, and we get a higher viral load in the body, you have more T cells that are going to be affected. And now you start to see the symptoms that are getting worse. And so that is how the symptoms progress and the stages of HIV progress. So highly active antiretroviral therapy is something called HAART. You might hear that someone's on HAART therapy or ART therapy. Sometimes it's abbreviated to active antiretroviral therapy. This is going to be our treatment to keep the HIV at bay or under control. We can't eradicate it. We cannot yet kill the virus completely, but we can keep it almost where it's undetectable. But it's going to include at least 3 medications and sometimes more, and they all work differently to reduce the viral load. So that's why if you just give one drug, it'll reduce the viral load a little bit, but these viruses mutate and the antiretroviral drugs will all have a unique way of acting. And the more ways you can impact the HIV, the better for the person. So because remember, as long as there's HIV, active HIV, it's going to continue to attack every T cell that it can because it needs a host. But if you can reduce the amount of circulating HIV, you can increase the amount of functioning T cells and thereby increase this person's ability to have a functioning immune system. Now, so that you understand, the individual will be on multi-drug therapy for the rest of their life, and at least 3 meds, maybe more. And yet, for the purpose of this lecture, we'll focus on one in particular, zidovudine. We're not going to go into all the different antiretroviral drug therapies, but there are many. And so this video from Khan Academy, specifically for nursing students, really helps you understand the HAART treatment. You will carry this information forward into your med-surg complex care courses as well as into your practice. So it is worth your time to watch. It's not a very long video, but to get an idea of, with this animation and narration, how this HAART therapy works. And it is something you might see on your NCLEX boards. So I would say it's a good watch for you. These are 4 or 5, I think, different types of antiretroviral drugs here. And we're not, like I said, we're not going into all of these, but this gives you an idea of how they all can work. And I told you for HAART therapy, the individual will be on a minimum of 3 of these. So they may be on 4, they might be on all 5, but it's because they all work differently to help make the virus unable to replicate. The adverse effects are numerous. So let me go back. So you see all these different classes of antiretroviral drugs. So each one of them works differently, has a different mechanism of action. So you can understand that the adverse effects are going to be very different depending on which drugs they're on. And because they're going to be on more than one, they're going to have more adverse effects. So that's something that you would use to look at if you're working with patients on heart therapy. So let's talk a little bit about zidovudine. AZT is another name for zidovudine, or Retrovir is also called. This was our very first drug, and it's an NRTI. So I'm going to come back over here and show you. Here's a reverse transcriptase inhibitor. It's part of this family, the RTIs, which blocks the activity of the enzyme reverse transcriptase. And when you watch that video from Khan Academy, you'll understand the role of reverse transcriptase and how it then creates the HIV replication. But that was the first place that science targeted for controlling HIV. And zidovudine is still used, but the reason we're using it here in pharmacology that as our target or our focus for the antiretroviral drugs is because it is the only antiretroviral drug safely used in pregnancy and newborns. I want you to think about that. So if you have a woman who has HIV and she is pregnant, she cannot be on heart therapy, not during her pregnancy, because to be doing heart, you have to be on at least 3 different antiretrovirals. Well, the only antiretroviral safe for use in pregnancy is zidovudine. So she will be on zidovudine, probably monotherapy, single-use therapy, which after pregnancy is over, she will then transfer back to heart therapy. Newborns who are born with the HIV are also treated with AZT or zidovudine because it is safe for use in them as well. Now, what happens is the adverse effect you need to focus on for zidovudine is the bone marrow suppression. So now you have an individual who has HIV and is at risk for infection because of the HIV, but then their drug therapy also causes bone marrow suppression, which means they're also going to be at risk for infection that way. Plus, their red blood cell counts might be low, so that gives them anemia and fatigue. And we have to look at platelet count as well to see if they have the ability to coagulate appropriately. Zidovudine can be given as an oral or an injectable drug. So what are your nursing implications here? When it comes to antiretroviral therapy, you really need to thoroughly assess what the individual understands about being on antiretroviral therapy, which means they have to take their drug exactly, precisely as ordered. Viruses have a very strong ability to mutate, and they will. And so a missed dose of an antiretroviral drug means that gives the opportunity for mutation, which means that drug may no longer work, and they'll have to switch to a different drug. You always want to make sure that your individual patient is healthy enough to take this drug and look for contraindications or conditions that would mean we shouldn't use it. For instance, if you're going to give a drug that's an antiretroviral, your patient is pregnant, it needs to be zidovudine and not one of the other drugs. So what about patient teaching? Be sure to teach proper application technique for the ointments, if there's an aerosol powder, and so on. So for a cyclovir and perhaps genital herpes, what would be the appropriate way to put that on? Well, they have to wear a glove, or sometimes it's a finger cut so that it's not a full glove, it's just one that covers one finger, to apply ointments to their affected areas, even around their mouth. But any open lesions, and they're applying a topical agent, they need to wear gloves and then remove the gloves and wash their hands thoroughly so that they don't transfer that virus to another part of their body. before somebody begins another medication that the prescriber might not know about, and even over-the-counter medications they need to talk to their prescriber when they're on an antiviral or an antiretroviral drug. We're going to emphasize the importance of good hand hygiene again. And if you looked at the video about hand washing to prevent the spread of COVID, you'll understand why I'm talking about, again, the importance of good hygiene here. And we have to remind our patients that the antiviral and antiretroviral drugs don't cure viruses, but they help to manage the symptoms and manage the activation of the virus and the how much the activity it's having in the body. So that's why somebody who's had the chickenpox and has that varicella zoster virus in their body will always be at risk for developing shingles because the virus is in their body. We cannot eradicate it. We can only control. Now, our own immune system tends to control the activation of that virus, but when somebody's immune system is compromised, perhaps due to extreme stress, they can have an outbreak of the shingles virus, shingles, because that varicella zoster virus becomes activated. It's really important that these drugs are taken as they're supposed to be, on a schedule for the full course of treatment. So that is part of your nursing priorities in teaching. And then they need to start these drugs at the earliest sign of a recurrent episode, for instance, of genital herpes, herpes zoster, shingles, as soon as, and the skin sensations will happen before the lesions open or even show up. So once somebody's had their first episode of genital herpes outbreak, oral herpes outbreak, or shingles, they know what that sensation is, and they know that's exactly what's happening. And they need to get in touch with their provider and get a prescription and start that antiviral therapy immediately, as soon as they know they have symptoms. Of course, you're always going to monitor for adverse effects. And if you remember now, the AZT, yes, the zidovudine, our adverse effect we're focusing on is bone marrow suppression here. And then look for therapeutic effects. Depending on which viral infection we're trying to treat, it will change, right? Well, primarily the one I showed you pictures of and talked about was the shingles or genital or oral herpes virus. So you want to see those things going away and clearing up and not persisting. That would be a therapeutic effect. And with our AIDS or HIV infections, we want to see an increase in T cells. That's getting really beyond what we need to be looking at here. But you want to see a decrease in flu-like symptoms, a decrease in herpes flare-ups, and you want to see crusting of herpetic lesions. That is the end of this lecture. It's pretty straightforward, these antiviral drugs that we're focusing on. Overall, the understanding of antivirals and how they work and how they're different than antimicrobial or antibacterial drugs is really important. And other than that, I wish you happy studying.